one of the things we said is, well, if the kids have the antibody, do you think that they will respond to treatment? We knew about leucovorin. So what we did is the kids that were positive, 44 of them, we treated with leucovorin, 2 milligrams per kilogram. And this was open label, so they knew they were getting it. And then we compared them to something called a waitlist control group. And these were kiddos that were essentially waiting for results. Neither of them made any other changes. And when they came back to the clinic, we asked them to rate whether things got better or worse on several different aspects. But the most important ones were language, and behavior. And what we found is that in all the language measures, receptive language, expressive language, and verbal communication, there was improvement. So higher up is improvement. So you can see the black dots are the ones that were treated. So you could just see, you don't even need statistics to see that there's more black dots above the line here than there are clear dots.
Jeez.
We also found that it improved stereotype behavior and attention. And if you look at who improved, you say those that improved in receptive language, about 66%, 67% improved in expressive language, receptive language, and verbal communication. In about a little less, 40% improved on verbal communication, but attention improved in about 60%. Mood about 50%, stereotype behavior about 50%. So it wasn't everybody, but it's a substantial number. So then, so we said, wow, this is really interesting and a potential treatment. But of course, what we did first was something called an open label study. And an open label study means people know that they're getting the drug. So they're biased, right? They say, oh yeah, this thing worked. Yeah, I love this. So we had to do the double-blind placebo-control study. And at this time, I was at, when we did this study, I was at UT Houston, and I just got recruited to Arkansas Children's Hospital to lead their autism program. So I said, well, the first thing I'm going to do is do a controlled study on leucovorin. And that study was published in 2016. And what we did is we randomized kids, 48 kids, to either see a placebo or leucovorin. At that time, we were calling it high-dose folinic acid. We don't like using folinic acid anymore because so many people confuse it with folic acid.
Mm-hmm.
So we've kind of changed to just saying leucovorin so there's no confusion. But it's essentially the same molecule. And so in our open label study, we found that language was improving. So that was a great thing because what we could do is, many problems that we have in studies of autism is that there isn't objective measures of improvement. Many of them are parent questionnaires or, what does the physician think is better? Is it not better? Very thing. But for language, you have very sophisticated measurement tools that can measure many aspects of language. And you can have somebody, a trained person, to actually do the measurement. And they don't know whether the child's on the medication or not. So we can actually put numbers to it. And so what we found is that you can see here in 12 weeks, the ones that were on leucovorin or folinic acid, their verbal communication increased dramatically compared to those that were on placebo. And of course, they were getting speech therapy and everything, so they improved a little bit, but you can see the difference here was dramatic.
Yeah.
And then we asked the question, because in this one we had all comers, those that were positive and negative for the folate autoantibody. And so we asked, does it matter if you're positive or negative? And we found that in fact it did. And if you were positive for the folate autoantibody, if you had folinic acid or leucovorin, there was a 77% response rate. And there's an important number called number needed to treat. So that's how many patients you have to treat to get one. And most people, right, you go to the doctor and you think that number should be 1, right? You go to the doctor, they give you a drug, you're all better. So people will be surprised to find out in most clinical trials that number is anywhere from 6 to 8. So you have to treat most medications. You have to treat 6 people just to get the effect that you want. So a number of 1.8 is very good, and this is looking at a response criteria of a very significant response to folinic acid. Of course, there's other kids that have more of a lackluster response that are slower. So this is pretty good. Now, what we did is we were able to equate it to how many hours of speech therapy this equaled. It was 177 hours. So that would be 3 hours a week, for a year, or about $7,000 worth of speech therapy for $300 worth of a drug. And it's not only important not trying to put down speech therapy, but the fact is, we were talking about this. Language is so important, and the inability to communicate causes so many problems in children trying to recover and learn. So it's just the fact, if you can get them faster to the place they need to be, they'll be in a lot better shape.
Yeah. And even I think the lack of language, the inability to convey their needs is a big path for self-injurious behavior. I think that's where.
Yes, I do, because they get frustrated. You're absolutely
Yeah.
right. And that's what we're learning, right, with the spellers and such, that there's stuff in there.
Yeah.
They can't get it out. And so it's very frustrating for them. So, they can't tell you what they want to say.
Head banging and stuff.
So that's why language is so important. Now,
And with that language and the communication, do you think that's what it's doing? Is increasing the white matter tracks from like Wernicke to Broca?
well, I think, yeah, I don't, so yes. So there's a nice study I didn't show where they actually looked at changes in the brain, in the white matter, with very sophisticated MRI techniques. And that's what they showed, is that the improvement actually paralleled more development of the white matter. And so one of the things that we have to understand that's common about like language and socialization is that they use parts of the brain that are really far away from each other. They use the back of the brain and the front of the brain. And so when the neurons aren't working well, it's very hard for them to synchronize those long distances. And if the white matter isn't in good shape. So those are probably why we see these symptoms in kids with autism, because those particular higher level functioning, are things that really need these connections far away from each other. And it may be why we see some of them have certain splintered skills, right? Because like mathematics is in really just one part of your brain, right? And so that can overdevelop, whereas the rest of the brain isn't developed. Yeah.
Oh my gosh, those distal connections with that white matter track. Like maybe the Arcuate Fasiculus with the language track, I think maybe is rescued.
Yes, I would think so.